Did you know that every 6 minutes, a senior suffers a stroke that could have been prevented? It might sound like just a statistic, but behind that number is a grandmother who won't tell bedtime stories again, a father who'll never walk through his garden, a life that could vanish in an instant. And here's the most concerning part. A recent study revealed that many of these tragedies are linked to the improper use of 4 very common medications. Medications you probably have in your home right now. They're often prescribed with the best of intentions, but hidden dangers are emerging in alarming ways, especially due to how they're being used. Zin, I need you to pay close attention, especially to one of these drugs that personally concerns me the most. Millions of people take it every single day, thinking it's harmless. But it's actually been found to significantly increase, sometimes even triple the risk of having a stroke. If you're over 60 or care for someone who is, let me be clear, what I'm about to share could truly save a life. And even more importantly, I'll show you safer alternatives to protect your brain health and avoid potential harm from these medications. Let me explain what happens inside your body during a stroke. Picture your brain as a city. Your neurons are the houses. Your arteries are the roads that carry oxygen and nutrients, vital fuel, to keep everything working properly. A stroke happens when traffic in one of those roads comes to a sudden stop. There are 2 main ways this can occur. The most common type is called an ischemic stroke. This happens when a blood clot suddenly blocks an artery in the brain, cutting off the supply of oxygen. The neurons in that area begin to die within minutes. Many of these individuals also have cholesterol buildup in the arteries of the neck, heart, or legs, adding to the risk. The second type is a hemorrhagic stroke. In this case, a blood vessel ruptures. It might be a weakened artery or an aneurysm, and the leaking blood floods the surrounding brain, tissue compressing and damaging it. Both situations are devastating. And as we age, our brains become more vulnerable, especially if there are existing health issues, like high blood pressure or uncontrolled diabetes. But there's another major risk: the improper use of the medications I'll share with you now. Let's begin with the first one. Number 1. Non-steroidal anti-inflammatory drugs. This group of medications is incredibly common in many households. These include drugs like ibuprofen, diclofenac, and naproxen. Sound familiar? Hey, they're often the go-to for headaches, back pain, arthritis, or joint stiffness in the morning. People buy them without prescriptions and take them casually, assuming they're safe, and that's exactly where the danger lies, in their false sense of safety. Now, for a young person with a healthy heart and kidneys, an occasional ibuprofen usually isn't an issue. But for someone over 60s, especially if taken daily or in high doses, the situation is completely different. They stop being helpful and start becoming dangerous. But why is this such a big deal? Here's what happens in your body when you use these medications carelessly. First, they increase your blood pressure. Think of your arteries like garden hoses. Blood pressure is the force of the water moving through them. NSAIDs make your body retain sodium and water, which increases the volume of blood flowing through those hoses. At the same time, these drugs can make your arteries stiffer. The result? More fluid moving through narrower, harder pipes, which causes the pressure to spike. And we now know that high blood pressure is the number 1 risk factor for stroke. It's like putting too much pressure on the plumbing system in your house every day. Eventually, something gives. But that's just the first problem. The second way these medications can harm you is more subtle. Here's what you need to know. When you take these medications, they block a substance called acetylcholine. This is a natural messenger in your body, essential for the proper function of your muscles, including the bladder. But it's also absolutely vital for memory, concentration, and mental clarity. It works like the oil that keeps your brain's gears running smoothly. The problem is that these medications don't just work on the bladder, they travel throughout your entire body, including your brain. And they can block acetylcholine there too. Over time, this can lead to confusion, memory loss, dizziness when standing up, and excessive daytime drowsiness. Many people mistake these symptoms for signs of aging without realizing that the little pill they're taking for bladder control might be quietly dulling their mind. And here's something even more concerning. Blocking this chemical messenger can also affect blood flow to the brain. The arteries become stiffer and lose their ability to dilate properly, especially when the brain demands more oxygen and nutrients. This can create low-flow areas in the brain and increase the risk of stroke. And if we add to that the fact that these medications can cause dizziness, blood pressure drops, and even falls, the risk becomes even higher for older adults or those with hypertension. What can you do if you're currently taking one of these medications? The first step is to check the name of the drug. Ask yourself, is this an anticholinergic? If you're not sure, don't worry, look it up online or call your doctor directly. And now comes the most important part. Ask this question. Doctor, could this medication be affecting my brain? Is there something safer for someone like me? The good news is, yes, there are safer alternatives. One of them is a newer class of medications called beta-3 agonists, such as mirabegron. These work differently, without interfering with acetylcholine, and they have a much lower risk to the brain. For many people, it's a safer choice, but it's not just about pills. There are also natural and highly effective strategies for this problem. For example, Kegel exercises help strengthen the pelvic muscles and improve bladder control. And bladder training, that is, going to the bathroom on a schedule, can help retrain the urinary reflex, so you don't feel the urge constantly, and don't underestimate small changes. Reducing caffeine, alcohol, and fizzy drinks can make a huge difference. Urinary incontinence deserves a solution. Of course, but that solution shouldn't come at the cost of your brain or increase your risk of a stroke. Now that you know about 2 common medications that can silently harm your brain, it's time for the most critical part of this video. Let's talk about the third type of medication, the one many people think is a miracle, but hides a dark side: oral corticosteroids. I'm referring to drugs like prednisone and dexamethasone. If you've ever had a severe asthma attack, a bad bronchitis with heavy phlegm, an autoimmune disease, or a strong allergic reaction, you'd probably know what I'm talking about. These medications can reduce inflammation, lower fever, relieve pain, and help you breathe more easily in just a few hours by opening up the airways. But here's the warning: using corticosteroids for extended periods and without proper monitoring might give you relief today, but leave you with a high price to pay tomorrow. And this cost is not minor. One of the biggest risks is an increased chance of stroke, especially in people whose brains are already weakened or vulnerable for any reason. Why? Because corticosteroids don't just affect one part of the body, they act on multiple systems at once, and that can throw your entire body off balance. I call this the triple threat of corticosteroids. First, they raise your blood pressure. They cause your body to retain a lot of sodium while depleting potassium. That leads to more blood volume and forces the heart to work harder. Second, they raise blood sugar levels. They interfere with insulin and can even trigger drug-induced diabetes, and in people who've never had diabetes before. They also affect your kidneys and your platelets. Your kidneys are the body's master filters, and these anti-inflammatory drugs can gradually damage them, especially if they've already aged or been strained by poor lifestyle habits, a pro-inflammatory diet, or improper hydration. And there's more. These medications can increase clot formation in places where clots shouldn't form, like inside the brain's blood vessels. Now, listen carefully. When used over long periods, these drugs can cause persistent inflammation in the lining of your arteries. This gets even worse if your diet is high in sodium, processed foods, and you're not drinking enough water. This inflammation acts like sandpaper, constantly scratching the inside walls of your arteries. Over time, it creates rough spots, perfect places for cholesterol to stick and form plaques. And if a piece of that plaque breaks off and travels to your brain, it can cause a disaster. So, what do we do then? Should we just live in pain? Of course not. The key is in the strategy. Firsthand, I'll always say this: never stop any medication on your own without talking to your doctor. That can be just as dangerous, or even worse. The solution starts with an honest conversation with your physician. Ask directly, "Doctor, considering my age and my blood pressure, is this the safest option for me? What's the lowest effective dose I actually need? And for how long should I really take it?" Also, it's important to explore other options, including natural ones, that can be surprisingly effective. One of the safer alternatives for chronic pain, although not natural, is paracetamol, also known as acetaminophen, is often considered a better option for heart and kidney health. There are also topical treatment creams or gels with anti-inflammatory agents, like diclofenac or ibuprofen, that work directly on the painful area. This reduces the risks that come with taking pills that affect your entire body. And don't underestimate the power of physical therapy, acupuncture, and guided exercise. In many cases, moving more can help reduce pain far more effectively than staying still or misusing medication. Now, if we talk about natural remedies, there are some powerful tools. Turmeric, for example, has proven anti-inflammatory properties. You can use it in powder form as part of your daily meal soups, smoothies, salads, always with a pinch of black pepper to improve absorption. The typical dose ranges from half to 1 teaspoon a day, which equals about 1 to 3 grams. If you prefer capsules, there are many concentrated preparations available with effective doses around 500 to 1,000 milligrams per day, always under medical supervision, especially if you're on other medications. Is another natural option worth mentioning. Aloe vera creams. These have a calming, anti-inflammatory effect directly on the affected area. They can be especially useful for relieving joint or muscle pain, without overloading your system with substances that increase blood pressure or damage blood vessels. The goal is not to suffer or to medicate recklessly, but to find a balance between relief and protection. Now let's move to the second group of medications that many people take daily, without realizing they might increase the risk of a stroke. These are often used to treat a very common issue that few people openly talk about: urinary incontinence or overactive bladder. For millions of adults, especially seniors, the fear of a leak can limit their lives. They stop exercising, avoid going out, and even feel embarrassed to laugh freely. To manage this, many turn to a group of medications known as anticholinergics. You may have heard names like oxibutynin or toltrodine. These drugs help relax the bladder and prevent accidents. And yes, they work very well. But what most people don't know is that these medications can also directly affect brain function and increase the risk of stroke. And that's where the real danger lies. That excess sugar in the blood damages the inner lining of the arteries, making them stiff, yet fragile at the same time. Third, corticosteroids can alter cholesterol and thicken your blood. They raise LDL, the so-called bad cholesterol, and increase your risk of developing blood clots. All of this sets the stage for a stroke, damaged arteries, high blood pressure, elevated blood sugar, and thicker blood that could clog a vessel at any moment. So what if your doctor has prescribed you one of these medications that are often essential? The answer isn't to stop taking them on your own. The key is to use them wisely and with extreme caution. This is where you need a clear conversation with your doctor. Ask them directly, "Am I on the lowest possible dose, and for the shortest time necessary? Are there any other options that could help me reduce my reliance on corticosteroids?" In conditions like asthma, bronchitis, or chronic phlegm, inhaled corticosteroids may be used instead. These tend to have fewer systemic effects. And in cases like arthritis, there are other medications that can help you gradually reduce or even eliminate the need for corticosteroids altogether. There are also natural options that can support your body during this process. For example, turmeric, either as a spice in your meals or in capsule form, can help safely reduce inflammation. And green propolis extract, taken in drops, has shown strong anti-inflammatory effects and can help regulate the immune system, especially in chronic conditions. But If there's no other choice and you must continue with these medications, then it's time to implement a parallel protection plan. This means monitoring your blood pressure, blood sugar, and cholesterol much more closely. It means eating with very little salt, avoiding refined sugars and ultra-processed foods, and moving your body daily. That's absolutely essential, because when you're on corticosteroids long-term, your body, especially your brain, needs more protection than ever before. And now, we've arrived at what might be the most dangerous group of medications for the brain. Not because they're inherently bad, but because they're so often misused, especially in older adults. Antipsychotics. I saved this category for last, for a reason: it carries the highest risk and is often prescribed inappropriately to the elderly. Medications like risperidone, olanzapine, quetiapine were originally created to treat severe psychiatric conditions like schizophrenia. And in those situations, used correctly, they can absolutely be life-saving. But what we're seeing today is very different. More and more older adults are being prescribed these drugs for off-label reasons, such as managing agitation, anxiety, or aggression in patients with dementia. Even more alarming, people with no mental illness at all are sometimes taking them long-term just to sleep better, without ever trying safer alternatives first. In an overwhelmed healthcare system, these drugs become the easy fix, a pill to calm a restless patient. But in truth, there is silent danger. Regulatory agencies like the FDA have issued their strongest warning, known as a black box warning, against this type of use. And for good reason. When misused, these medications nearly double the risk of death in older adults. And the risk of stroke can triple. Here's why. First, they sharply lower blood pressure when standing up, a condition known as orthostatic hypotension. This can lead to falls, fractures, and most seriously, brief episodes where the brain doesn't get enough blood. Repeated often enough, this can result in a stroke. Second, they can disrupt the heart's rhythm, causing arrhythmias. These irregular beats increase the risk of clots, which can travel to the brain and cause a cerebral infarction. Third, they disrupt metabolism, raising blood sugar, increasing cholesterol, causing rapid weight gain, and sometimes inducing diabetes within months. And on top of that, recent research shows they thicken the blood, making it stickier and more likely to clot. So, what can you do if your loved one has been prescribed an antipsychotic for dementia or agitation? You need to be their advocate. Ask the doctor clearly and firmly. Have we tried every non-drug option first? What's the plan to taper and stop this medication as soon as possible? Because the truth is, there are alternatives for treating agitation in dementia, and most of them aren't in the pharmacy. The real first step is to understand what's happening with that person. Are they in pain but unable to express it? Are they fighting an infection? Are they scared, confused, or simply bored? The answer is often not a pill, but an unmet need. Creating a calm environment, playing familiar music, simplifying tasks, speaking gently, and validating emotions. All of these can be far more effective than any prescription and immeasurably safer. An antipsychotic in an elderly person should be the last resort, for the shortest possible time, and only after all else has failed. Never for convenience. Never as a shortcut to better sleep. Because the price of that peace may be a devastating and entirely preventable stroke.